Hi, this is Dr. Farling. I want to be going over with you today is the number one epigenetic process that's creating 95% of all diseases. And it's taken me a while to come to understanding this, but the picture that I show you here, which is based on the neurobiomedicine model, which has the master nervous system, the immune system, and the endocrine system, and then we have down here what are called your foundational root functional causes. So this picture here is kind of how I think about someone, and I'm trying to figure out where's the physiology off, what is creating dis-ease, lack of normal function. And then it's got to be specific for you. It's got to be an individualized plan for you. There's no protocol here in my office. I hear people tell me, hey, can you give me a menu? Can you give me some recipes? The answer is no, I can't, because every person is different. So what that means is you have to learn about the foods and why you're going to be removing them. And you also have to learn about which foods are specific to you. I can't help you with that. So once we get the testing back and we say, hey, this is what you've got, you know now what you're doing and why you're doing it. And then you want to know this, that the immune system, 85% of it is located inside the gut. And over a time frame, if you eat something wrong that your immune system has produced an antibody against, whatever that food may be, specific to you, you will create an inflammatory response for days to weeks to months. And my experience with almost 5,000 patients is that you will not get better. You will not get better. If we do our re-examination of your ANS test, we can immediately see that someone's not doing what they're supposed to be doing, because everybody that's doing what they're supposed to be doing, the test gets better. But from a epigenetics point of view, if you eat incorrectly, no matter what we do here in the office, and no matter what else good you do, you could take a bunch of supplements. You can come here for every single visit. If your food is incorrect, you will never get optimally better. You might feel better for a short time frame, but you will not be improving your health to the most optimal level that you can. So the point of this video is to let you know that the number one cause, the number one epigenetic cause. So epigenetics again means our genes are stupid. The genes are turning on and turning off based on what we're doing. And different things will influence our genes and can have an epigenetic response, which means the genes respond good or respond bad based on what we're doing. The number one epigenetic, by the way, this is sound science. Way more sound than telling everybody that these problems that we're seeing are genetic. Only 5% of all disease is genetic. 95% is epigenetic. What is the number one epigenetic problem and epigenetic process in all diseases, in 95% of all diseases? Inflammation. Sustained inflammation. Where does sustained inflammation start? Back over to the picture here, in the gut. Now, why is that? Because God put 85% of our immune system in the gut. So there's 4 barrier systems that we have, which means we don't want things to get in past those barriers. You have your skin, loaded with immune. You have your gut, the most loaded with immune, 85% immune system here. You have your lung, loaded with immune, and then you have your blood-brain barrier. So when that inflammation, that sustained inflammatory response happens, again, there's no such thing as chronic inflammation, it's baloney. You are doing something to chronically irritate the immune system, and you are sustaining the inflammation. Most people are doing that through the epigenetic process of food not eating correctly, especially once we've identified what you shouldn't eat. And over a time frame, though, if you pull that out, you remove the food, guess what happens? The sustained inflammatory response goes down. So the number one epigenetic process involved in 95% of all diseases starts to calm down. And what happens? Miraculous things. And over a time frame, what does that mean? It means if you get that under control, you're doing the brain-based care if you need it, you're following your mental toughness program, and then over a time frame, you follow this. And you're diligent with this. This is not a diet. You've never heard me say the word diet in my office, because once you say the word diet, the next thing is cheat. So if you're a fat guy and you sneak a cookie, no big deal. If you're not supposed to eat whatever the food is that you eat, and you eat it, it is a big deal. because it whacks out the immune system and you create a sustained inflammatory response in the body and the brain for days to weeks to months. So even if you cheat twice a month, you are not going to get better, and gradually you're going to get worse. I've seen a schizophrenic patient go from being terrible to perfect to back to terrible again after he didn't follow my recommendations on what he should be eating. And now, guess what? He's locked in a psychiatric hospital for the rest of his life. But there was a 4-month period where he was totally normal. So food is huge. So when you eat something wrong and you whack out the immune system, you can create major sustained inflammatory responses all over the body. Those sustained inflammatory responses then show up inside of our body in one of 3 ways. They show up as metabolic inflammation. This can be cancer, cardiovascular disease, pulmonary disease, arthritis, hypertension, diabetes, weight gain, obesity, metabolic syndrome, Alzheimer's, Parkinson's, dystonia, anxiety, depression, bipolar, and addictions. They all usually have some type of a sustained metabolic inflammatory response. The second type of sustained inflammation we see is allergic inflammation. This is asthma, eczema, seasonal, dogs, cats, foods, psoriasis. And then the third big bucket of sustained inflammatory responses that we see is autoimmune inflammation / cancer again. The number 1 autoimmune tissue is thyroid. Number 2 tissue that gets attacked when you whack out the immune system becomes diabetes. Number 3 is anything gastrointestinal. That can be irritable bowel, ulcerative colitis, or GERD. Gassy, constipation also. And then we see brain, spinal cord, and nerves. This can show up as multiple sclerosis, dementia, Lou Gehrig's disease, Alzheimer's, Parkinson's, OCD, bipolar, depression, anxiety, addiction can all have an autoimmune component. So what does autoimmune mean? It means, hey, I'm not just having an inflammatory response. Now my own immune system has made an antibody and I'm attacking my brain. Or I'm attacking my thyroid. Then we see the more common autoimmune, rheumatoid arthritis, psoriasis, lupus. And then your risk of cancer goes through the roof if you have sustained inflammatory responses, because the immune system's ability to recognize a bad cell and get rid of it for you is totally compromised. So, to summarize again, the number 1 epigenetic process that's creating 95% of all diseases is sustained inflammatory responses. Because the immune system, 85% of it is located inside your gut, your food is the make or break thing that determines whether you continue to get worse or you get better, and then could you actually get to your optimal you. So it doesn't matter what disease name you've been given. If you help correct this process by removing the foods that we've identified specific to you, not a diet, not a protocol, you have opportunities. So thanks, I hope this was helpful, and I will chat with you soon.